Good afternoon. Thank you for joining us. This is Angela Socia, the Interim Director for Student Health and Wellness Cluster. This evening, we are very fortunate to have two experts to help shed some light and answer questions on the current coronavirus situation. We know this has created a lot of concern amongst the campus community and quite a few questions. This afternoon, our two experts are Dr. Francesca Torriani, who is an infectious disease expert. She is also the program director for infection prevention at UC San Diego Health, and Dr. Stacie San Miguel, who's the medical director for student health services. We will go through an agenda which will give you some of the science behind the virus, as well as the pattern of transmission, what we know about the current outbreak and situation globally, how you can protect yourself, as well as the response of UC San Diego Health and Student Health Services. This will be followed by a question and answer period. We're asking that you please submit your questions electronically through the Q&A process of Zoom. Annie Horton, who is the nursing manager for student health, and I will be reviewing these questions and bring them forward to the panelists in a few minutes. So, Dr. Torriani, would you like to begin?
Of course, I'd be delighted. So let me first speak about coronavirus. Coronavirus is part of a large family of viruses, some who cause illnesses in humans and others that circulate in mammals. 2019 novel coronavirus is a new respiratory virus that was first identified in Wuhan, the Hubei province in China. Many of the patients in the outbreak in Wuhan had frequented a large market where seafood and animals were also sold, suggesting that the virus likely emerged from an animal source. SARS is another coronavirus that you may have heard about, and this virus emerged to infect people and came from civet cats, while MERS, yet another coronavirus, surged in the Middle East and came from camels. How is this virus transmitted? This coronavirus, as we said, likely emerged from an animal source and then started spreading from person to person. Some viruses are highly contagious, such as measles and chickenpox, while other viruses are less contagious. And so far, the 2019 coronavirus appears to spread similarly to influenza or other respiratory viruses. Person-to-person spread with MERS and with SARS is thought to have happened mainly via respiratory droplets produced when patients coughed or sneezed. The infectious droplets are then either inhaled or fall directly into the eyes or the mouth, or they get on the hands by touching contaminated surfaces and then are spread by contaminated hands. And the spread of MERS and of SARS between people has generally occurred between close household contacts. And the same is true for this novel coronavirus. We clearly see spread between close household contacts and people who really live in a very small environment and very intimate environment. How has the outbreak spread? I'm showing you here a slide borrowed from the BBC that shows a map of China. And as you can see, the Wuhan city in the January 20th Wuhan city was the epicenter of this outbreak, with 291 cases appearing on January 20th. 2 days later, this had multiplied to 446 cases, and additional regions or cities around Wuhan were also involved with 1 to 50 cases. Just 2 days later, this had multiplied to 860 cases, with now a whole region having multiple cases presenting. And again, 2 days later, there were 2,021 cases. 2 days later, 4,524 cases. And then on January 29th, 5,970 cases, and more than 500 of these were in the Hubei province. Now, what is the situation as of January 29th, 2019? As we can see, the main region is in China with more than 7,600 cases, and then a few cases in Singapore, 7 cases in Australia, 5 cases in Germany, 4 cases in Germany, 5 cases in France, 5 cases in the United States, and today we know that an additional case was found in the spouse of the Chicago patient, and 3 cases in Canada. Let me show you here one of the best maps that we use and many other institutions use to follow the spread. This is a map of global cases by Johns Hopkins. It is available on the web, and it shows that as of the 29th of January, there were 7,783 cases worldwide. Of these, 7,678 were in mainland China. On your right-hand side, you see at the top, there have been 170 deaths worldwide. The majority of these deaths are in mainland China. And then if I hover on the yellow slide in the bottom, I can see the cumulative case. But what I can see is that there's a big blob in the middle that covers the region of Wuhan, and then other large focuses in Hong Kong, Shanghai, and a smaller one in Beijing. And when I look in more detail, once again, we see how this has spread regionally. This, as I said before, is a cumulative graph that shows you the rise in cases over time, starting on January 19th and until January 28th. In the orange curve, you can see the cases in mainland China. In the yellow curve at the bottom are the cases at other locations. And of course, you can see that the cases in China are predominant, with a very small number of cases in other places than mainland China. What are the clinical symptoms and the timing of the infection? For confirmed 2019 novel coronavirus infections, the reported illnesses have ranged from very mild to severe symptoms of respiratory disease. And the most common first presentations in China has been pneumonia, and the symptoms have included fever, cough, and shortness of breath. And in general, we have found on chest X-ray, we have confirmed pneumonia. And these are clearly the most severe presentations that were identified first because these patients came to the hospital in large numbers. Symptoms have started in general 2 days to 14 days after exposure. And this slide is really important because it helps, it is what defines basically the person under investigation. It defines who needs to be tested for the coronavirus. Now, clearly, I know that there has been a lot of anxiety about how bad this epidemic is, and it's clearly something that is spreading. But when we look at the mortality, so at how many people die from this disease, we can see that there were, as I said before, 170 deaths out of more than 7,700 patients, and that gives us a mortality of 2.2%. And in comparison to the 2002 SARS outbreak, we can see that the mortality is much lower. And just if we compare it to the current California influenza season, just in California alone, these last months of the year and this month, we have had 149 deaths in California alone. And the mortality rate of influenza, depending on which strain of the virus it is, it goes from 0.1% to 2.5%. And so it really suggests that this coronavirus is associated with an overall lower mortality than SARS and very likely than seasonal influenza. And as you may know from epi studies, the estimated mortality now is likely going to be higher than subsequently because the people getting tested are those with the more severe disease. How to protect yourself. This is an inhabitant of Wuhan city, and he put his post on how he was keeping healthy. And so we thought that some humor here. He's doing well, and he reports from Wuhan. Prevention, there is no vaccine to prevent coronavirus infection and no antiviral treatments. And so the best way to prevent infection is avoiding being exposed to this virus. And this is why you have seen basically a travel alert coming up for China, and also in an attempt to close this epidemic and contain the epidemic, Chinese authorities have closed down travel from the towns in Hubei province. And the first thing we would say is basically you can prevent a lot of respiratory viruses just by washing your hands, avoiding touching your eyes, nose, and mouth with unwashed hands, avoiding close contact, really close contact with people who are sick, staying home when you're sick, covering your cough and sneeze, and really cleaning surfaces around you if you're sick so that you avoid contamination. And then to be protected against the flu, also getting the flu vaccine. Now I'm going to pass this to Dr. Stacie San Miguel so that she can describe the UCSD health response and student health response.
Thank you, Dr. Torriani. So UCSD Student Health and UC San Diego Health have been working closely together since this outbreak was identified. For the UC San Diego Health, they have developed a triage and response system. Essentially, they are confirming travel history to appropriate geographic regions within 14 days of symptom onset. And what we're looking for is to confirm respiratory symptoms such as pneumonia symptoms, fever, difficulty breathing, cough, chest pain. Upper respiratory symptoms may also be present in addition to those of pneumonia. If the travel history and the respiratory history is confirmed, then we'll put a surgical mask on the patient, and the patient is put in a private room with the door closed. Our staff have been instructed to wear personal protective equipment, and this consists of an N95 mask that has been fitted. We also have contact precautions by using gown and gloves, and eye protection, which includes goggles or a face shield. We're looking to confirm the presence of a respiratory infection, and we want to rule out other viral infections like the flu. So a physical exam will be done, chest x-ray, and maybe other tests will be done to confirm the presence of infection. If the patient appears to meet the CDC criteria for testing, UC San Diego Health clinicians will contact the work with the infection preventionist and contact the San Diego Public Health Department, who would follow the guidance of the CDC. Approved testing, which involves getting swabs from the nose and throat and obtaining a blood sample, are sent to the CDC. Currently, the turnaround time of 48 to 72 hours is the duration after it reaches the CDC. Okay, thank you. So just to review, the CDC also has a definition for a person under investigation, also a PUI, fever and symptoms of lower respiratory illness, including cough and difficulty breathing, and currently a history of travel from Wuhan City, China in the last 14 days before symptom onset, or in the last 14 days before symptom onset, close contact with a person who is under investigation for 219 nCoV while that person is ill. We understand that information is coming in daily and the situation is fluid, so some of these criteria may change, as well as the screening criteria may change, but we are prepared to modify our practices as soon as we have guidance from our public health departments. Fever or symptom of lower respiratory illness, such as cough or difficulty breathing, and in the last 14 days, close contact with an ill laboratory confirmed 219 nCoV patient. Close contact actually is defined as a close contact within 6 feet approximately, or 2 meters, or within the room or care area of a novel coronavirus case for a prolonged period of time. These criteria are intended to serve as a guidance for evaluation, and patients should be evaluated and discussed with the UC San Diego infection preventionist, who will coordinate with public health departments on a case-by-case basis if their clinical presentation or exposure history is equivocal, such as if there's uncertain travel or exposure. The disposition of a person under investigation. If the PUI is stable, the patient can generally go home. The public health will provide guidance as to the patient's restrictions and disposition. Quarantine at home while awaiting test results. If the results are positive, admission to the hospital is likely, and the patients will only be discharged home only with the San Diego Public Health Department approval. Now I'm going to go over what we do at the UC San Diego Student Health Services. UC San Diego and Student Health and UC San Diego Health have been collaborating together, and we have been working with other UC campuses and their student health clinics with the UCOP and the San Diego County of Public Health. There has been monitoring and we are working with the UC San Diego Health Infection Prevention to closely monitor the situation as it has been evolving. Lots of information has been coming in, and we've been looking at the scientific information and the information provided by the World Health Organization and the Center for Disease Control. We are following the guidance of these international national, state, and local public health departments during times of public health outbreaks. Our policies for the UCSD faculty, staff, and students are based on the recommendations of these public health organizations. In terms of the communications that we've had, we've sent out 2 all-campus announcements on the novel coronavirus, one on January 23rd and another one on January 27th. These both summarize the current status of the novel coronavirus, as well as provided information for students, staff, and faculty on preventive measures and how to access care. This information has been posted on our website for student health. Please understand that the situation is evolving and additional updates and adjustments to our policies will be made if appropriate. The standard practice for someone presenting at student health ever since the H1N1 outbreak in 2009, any student that presents at student health with respiratory symptoms are masked at check-in. Increased efforts to support students at potential risk for the novel coronavirus include the following. We've recommended students with symptoms that they call before arriving at student health for guidance. We've also had enhanced screening implemented January 23rd, and this includes travel to Wuhan, China within the last 14 days with symptoms of fever and cough or difficulty breathing, or with contact with someone with a positive travel history that is symptomatic. Students identified to be at risk are placed in our isolation room and are evaluated by our physicians for evidence of lower respiratory infection and tested for other causes of respiratory infection such as influenza. If we identify any patients that meets the PUI definition, or if we have any questions, we contact the UC San Diego Health Infection Preventionist for further direction. UC San Diego Health and UC Student Health is committed to supporting our students. At this time, no UCSD students seen at Student Health have met the PUI criteria. No students have required transport to the hospital. We are providing masks for any student health patient that presents and are being evaluated that have respiratory symptoms or fever. We suggest that students that are ill, especially with fever, stay home and do not go to class. They can call Student Health Services at this number, 858-534-3300, to speak to an advice nurse at any time of day for guidance and recommendations on next steps. This includes after hours. We have an after hours nurse line. And the students, regardless of their insurance, can call this number for guidance. And when appropriate, the students will be sent to the UC San Diego Health Emergency Room or Urgent Care after hours for evaluation. If a student is advised to stay at home, we have a no-note policy that is in effect. Oops. Okay, so that concludes our discussion. We're opening up to Q&A.
Thank you very much. We'll start through some of the questions. I'm going to try and work through some of the more general questions. How quickly could UC San Diego medical system respond to any student showing symptoms? Dr. Torriani, the response of the medical system, are we prepared to accept students with symptoms?
Could you repeat the question, please?
How quickly can UCSD medical system respond to any student with symptoms? Are we prepared?
Yes, we are completely prepared. We have many urgent care spots that are, and in addition, we have 2 fully equipped emergency rooms that are prepared and ready. And staff is educated to accept these patients and to treat them if needed.
How long does it take the virus to die outside the human body? If a person coughs and droplets are found on a surface, how long will they remain infectious?
The answer to that is unknown, and that's why we say the best thing is to clean surfaces, and you know, you don't need a special disinfectant to clean surfaces, but it's really to wipe down surfaces and mostly clean your hands every time you do a task. Please, please, please clean your hands with soap and water or with an alcohol hand gel.
A couple questions came in about the CDC's response time and testing. Is there an effort to expand testing to shorten that time to other facilities? And why is the testing something that every lab cannot do, sorry?
Yeah, so because this is a novel virus, the testing, the tests that we use had to be developed. And so because of the collaboration between Chinese officials, WHO, and CDC, the reagents were shared, and so CDC has developed the testing methodology. This clearly, you're pointing to a very important issue, which is that right now in the US, only the CDC does the testing. We expect that probably if this drags on and if more tests are required, that other public laboratories will pick up this task too, because clearly that is the bottleneck, right? We can only test through the CDC, and the more people we test who may or may not meet the criteria, the more time we will have to wait.
Is there a possibility that testing will expand as we learn more and more testing sites become available?
Yes, as I said, I expect public health laboratories to be given the reagents and to be able to perform the tests, but right now it's only with the CDC.
Okay, great. Here's a question. We have a student we think may have coronavirus. Are there isolation rooms they can live in for 3 days while they wait for the results of the test? So Dr. San Miguel, could you help explain how it would be assessed whether a student has the virus? Just to review that is something that a medical professional, how would be handled by the student health services?
So what we've been doing is when a patient comes in, they go through travel screening questions, or also if they've had any contact from someone who's traveled from Wuhan, China within the last 14 days, as well as if they have respiratory symptoms. If they have those two criteria, we put a mask on them and we take them directly to our isolation room, where they see one of our providers, one of our physicians who is going to evaluate them, just to ask them questions, see what kinds of symptoms they have, take their temperature and their other vital signs, listen to their heart and their lungs, and see if they need to do any further testing, checking their oxygen saturation percentage, checking whether or not we need to do a chest x-ray. We can test for influenza or other types of infections as well. And if it looks like there is some concern that the patient does have pneumonia, they don't have any of the other causes and they meet criteria, then we would call the UC San Miguel Health Infection Prevention on call.
Yes, so then the patient would be sent to an urgent care or an emergency room. The patient would be masked, the student would be masked, and if we determine that the student is a person under investigation and needs to be tested, that student, the student will be kept until ruled out. We will find that student will not return to the dorm until ruled out and cleared by San Diego Public Health.
Thank you very much. So I think to reiterate, we would not have a student that was medically assessed to be at any risk in the general population on campus.
Right.
All right, there are a couple of questions here about the parent, student, or individual, it is not a student, who is under investigation, a point under investigation in San Diego, and whether we would find out if there in fact is a case. Would San Diego Public County, I guess I'm phrasing and helping this because there are a couple questions in here, would the San Diego County Public Health Department be in communication with you, Dr. Torriani, about the details if there were a local case that had impact for our campus community, our health system?
So San Diego Public Health and actually all of the public health, local public health facilities are very well versed in working up, doing what we call contact investigation. So finding who the person who has a certain disease, whether it's coronavirus or tuberculosis or whatever, something that is contagious, what contact there has been, right? And you probably may be familiar with things that really, diseases that have consequences like meningococcal disease in campuses. And so they are very fast in determining who has had contact with the person who's infected and then call them in for further investigation, for symptom finding, and then possibly determining whether these exposed individuals need to be quarantined.
So I'm hearing that you have a very direct communication and regular communication with the San Diego Public Health Department. Is that correct?
Yes, I have daily conversations with them on this and other subjects, and I can tell you I have full confidence in them because they are here to protect us.
Thanks very much. There have been a number of questions again about mask use. I think it might be worth reviewing mask use. What are the indications for individuals? When should masks be worn?
So I think there are two roles for the mask. First, let's talk about people who are healthy and who do not have any symptoms of respiratory disease. We know from even randomized studies that out in the outside, there's too much turbulence to basically, there's so much turbulence that, and so much air exchange, that particles really don't stay in the air or don't are not infectious. So when we're outside, there is no need for a healthy person to wear a mask as a preventive measure. In people who are sick, what a mask does is, who are sick with a respiratory infection, what a mask does is that it will block the spread of droplets. So when I'm coughing, or when even I am speaking now, if I had a mask on, if I were sick and I had a mask on, the droplet produced by my speaking or my coughing will basically end up on the interior portion of the mask, and so stay there. And that is the best way of preventing the spread from a person who is sick with a respiratory infection.
Thank you. That's very much appreciated, because I think there's been a lot of confusion about will wearing a mask if you're well be a tool you should deploy. And it sounds like you're not recommending that is a good preventive measure, but I did hear strong recommendation for the hand washing.
Yes, definitely. It's your hand washing and hand washing and covering your cough and sneeze, and if you don't have a handkerchief, sneeze in your sleeve, because that's once again will stop the spread of droplets.
There's a question here about students who have underlying medical conditions. Actually, there were two, autoimmune disease or other serious chronic conditions that might make them more susceptible to virus. Is there a recommendation, or would you provide guidance for them to reach out to providers?
I think, so first of all, the situation is fluid, but what we know from the first articles that have been published and kind of a very in-depth analysis, and this is shared also at the level of WHO, is that coronavirus is a disease that is spread through cough and sneezing. So that is spread through large droplets. And therefore, these large droplets can be inhaled. And shown here in the conclusion slide is a person sneezing. And basically, you can see this fume of droplets going out. But you can also see that the droplets are falling not very far from the face of this person. And that is exactly what we think is happening with coronavirus. So as long as we keep a distance, we cover our sneeze and our cough, and we try not to interact with people who are visibly sick, and we kind of clean the surfaces around us, and most of all, clean our hands frequently. I think that we should be okay, even if you are immunosuppressed.
Thank you. There have been a number of questions about screening. Can you briefly review what screening practices we're using? We know that the airport screening has been expanded. Has there been any recommendation that college campuses, other sport events, any other places should have screening processes for individuals who are gathering?
So I think, and I will stop answering the questions because I'm taking everything away from Dr. San Miguel, but I think that, the screening at the airports is at two times, right? Before you're boarding the plane, just to make sure that you don't have a fever, right? And that screens people who are symptomatic and who could board the plane and then stay on that plane with many other people for 11 hours, right? And so that's the first screening. And the screening at the airports of entry has two purposes. One is, in those 11 hours, did a person who was exposed, now has this person become symptomatic? And so do we have to worry for the other passengers on the plane? But also the purpose is to alert these folks that they're coming from a region that has an epidemic, and so to propose to them that it may be a good idea to self-screen and to come to healthcare if they develop any symptoms.
And on campus, again, we're closely monitoring the situation. We're on calls daily, multiple times a day, getting the most recent information. And this is no different than, for example, if there are other outbreaks that have happened on campus, like measles or meningococcal infections. And so we would gather this information. We would seek the direction of the San Diego Public Health and the California Public Health and make a decision if we needed to about gatherings. But at this point, there hasn't been any recommendations from our public health organizations to do screening at large public gatherings.
Yeah, and remember, let's put it also in the context of many, many, many flights that have come from China, right, even from Wuhan, with many patients for 11 hours straight in that flight. And we do not have you know, those 300 plus patients coming every day, we don't have people now having sickness among those. So if you consider a large auditorium, that is much bigger and has many more air exchanges than an airplane over 11 hours.
Question for Dr. San Miguel. Please explain the no-note policy.
Yes. Okay. Well, it started about 10 years ago during the H1N1 influenza season, also known as a swine flu. I think that particular influenza season, that virus, for some reason, had a high affinity for students, for the individuals that were in college age. And basically, we were having many students coming in that were much sicker than what we're seeing now, coming in seeking healthcare. And we were trying to reserve our appointments and our staffing so that we could address the needs of the sick patients. So at that time, our director of student health worked with the faculty and the academic senate to say that if a student stayed home from class because they were sick and because we didn't want them to spread infection to their classmates, that they didn't require a note from student health.
Great. And that makes a lot of sense, that we want the students who are not well, if they can stay safely at home, to stay in and not be coming into student health. And the professors have all understood the benefit of having the students stay home, rest, get better,
right,
and not be out in the community.
Right. That being said, I think we do want students who are concerned, if they are concerned about their symptoms, or they are concerned about their travel history or maybe contact, that they could come in or call to see if they need to come in to be seen, and we will arrange to see them.
I think that's a great point. So I hear you saying we want the students to call for advice about whether you should stay home to review that you are appropriately caring for yourself, and not leave you making that decision independently, that student health is there to guide the student on their next steps.
Right, right. And I think the students also have to realize that we're in the midst of an influenza season. I mean, this influenza season started a little earlier, and there have been more cases than compared to last year. So yes, there's a lot of other viruses that are out there, so that we could potentially treat.
Great. Dr. Torriani, you just maybe a couple words about the fluidity of the situation and who's really monitoring this, and how does our community feel connected to the latest information, and maybe some reassurance that we are monitoring.
Yes, so first of all, just you may or may not be aware that in an emergency meeting today at the World Health Organization, or WHO, a public health global emergency was declared. And so that might, around the 2019 novel coronavirus, and that might be cause of concern, but it is mainly to gather and to exchange information, and to allow countries that are definitely have less means than the United States to really get more information and more help without the stigma of being poor or of the disease. And so I think that really that is the main purpose of WHO. There is, continuous monitoring at CDC. We are having, many calls and with expert groups and evaluating the situation. We are not working alone. We're really working as a group, and with also the scientific society, so that we can better understand and we can control and prevent this outbreak.
Thanks very much. We're really running out of time right now, and I just hope everyone is reassured that we are in good hands. We have incredible expertise within our community. Dr. Torriani and our colleagues in infection prevention, infectious disease, Dr. San Miguel leading our student health services. The teams are working very hard, staying on top of all the information, and we're working to communicate with you and keep you up to date. Information is changing, will continue to change. If we need to change our recommendation protocols, we will communicate with you. We'd love to feedback to know whether this kind of interactive Zoom opportunity is helpful for folks, because we want to be available to you. We are here to serve and take care of you. Thank you very much for your time this evening.
Yes, thank you.
Thank you. Stay healthy.